Hello guys, welcome back to my YouTube channel. In case you are clicking in this video for the first time, kindly consider clicking the subscription button, like the video, share, comment. Don't forget to turn your notification bell so that every time I post a video you will be the first person to be notified. So guys, I know consistency is not there, but don't just blame me. Sometimes you have to sit back, relax, and see what is happening, what is trending, what are you supposed to post, or what are they. You have to sit back and prepare what you will be shooting consistently. So guys, today I want to talk about fistula, specifically obstetric fistula. If you just hear a word obstetric, means pregnancy, labor and delivery. And fistula itself, it is abnormal opening between two areas of the body. Yeah, so obstetric fistula, we are going to say that. So okay, we have said that obstetric means pregnancy, labor and delivery. Yeah, and fistula, we have said it is so guys, an obstetric fistula mostly often develop during labor and childbirth, when the infant head descend into the maternal pelvis and cannot pass through it. So it's usually because of the woman's pelvis is too small, or maybe was poorly developed when the lady or the woman was growing up, or maybe it can be caused the infant is too big, or there is malposition or malpresentation. And we can say that the continual pressure during uterine contraction compresses the maternal tissue against hard bone on either side. So the gradual constriction of the blood supply damages the tissue, and that's why you will get that the fistula will develop at that point. So another thing that I want to say, initially there may be small area of central necrosis. Necrosis is cell death, but scarring from the crash injury often develop over much larger area, with which create a hole or a fistula. Yeah. So all about this fistula, let us look at the contributing factors. Let us look at underlying society issue about this fistula. What are the complications which may be associated with obstetric fistula? What can be done? What are the social physio psychosocial complication that it can bring to a woman, and also how can it be prevented? Because we know we have the primary prevention, the secondary prevention, and the tertiary prevention. So those are the things that we are going to look at this point. So stay tuned, make sure you watch this video up to the end. Don't forget to click your notification bell, and don't forget also to write your comment so that we engage. So what are the contributing factors of a fistula? What are the contributing factors of fistula? The most important contributing factor for the development of an obstetric fistula is prolonged or obstructed labor. You remember we said we have other causes. All this fistula can be brought by a woman's pelvis is too small. So what if the pelvic is too small? Obviously there will be obstruction. If the woman had a poorly developed pelvis, there will be obstruction during delivery. And also when there is a malpresentation and malposition, there will be obstruction. So the most contributing factor of obstetric fistula is the prolonged labor or obstructed labor. So if a woman with a prolonged or obstructed labor does not seek or receive timely emergency obstetric care, she may develop an obstetric fistula. And you remember I said when I was starting this video, a fistula is a hole that develops between two organs in the body, and obstetric means that it is pregnancy, labor and delivery. Okay, yeah. So the best strategic to address obstetric fistula is to prevent obstructed labor by providing safe and timely emergency obstetric care. When you are a midwife or you are a nurse in that specific hospital you are working, you have to identify, you have to diagnose obstructed labor and prolonged labor in a good time, so that you prevent mothers from getting this obstetric fistula. Don't wait until it is too long. So when now the mother will have to risk to get what obstetric fistula. So there are some other contributing factors that also may be related to this, the cause. So and one of them is young age at first birth. We usually know that when a girl approaches puberty, there are those changes that usually take place, or when a girl is in puberty stage, there are those changes that usually take place that help the woman to be able to pass through growth and development of, or that time is when the reproductive organs are developing. So you find that if a woman or if a girl get pregnant when she is too young, she will be at risk of getting obstetric fistula. When you first birth, you got pregnant when you are still young. Still young means that you are below 20 years. Yeah, if you are below 20 years, your body is still developing, so you are at risk of getting obstetric fistula at any point. Another thing, another contributing factors is COPD or cephalopelvic disproportion. Can be due to malnutrition. When you were growing up, you had malnutrition. You did not get enough nutrients for your bones to grow well. So you find yourself, you are having cephalopelvic disproportion. Also, insufficient calcium and vitamin D, resulting into pelvic deformity. If you're by the time or when you were growing up, you did not get vitamin D to help in, vitamin D usually help, vitamin D and calcium, they usually help in development of a bone, and also they prevent deformity related to bone. So if you lack these things when you are growing, you are at risk of developing obstetric fistula because your pelvic area were not developed, or pelvic area or your pelvic bone did not develop well. Also, large fetus, there are some mothers who are, they have a history of giving birth to a big baby. So if you are such mothers, your midwife should diagnose this at the right time, so that you find another way of delivering that is yes, and you prevent this obstetric fistula. Also, malpresentation and malposition of the fetus can also do what? Can also put you at risk of developing obstetric fistula. So another contributing factors is female genital mutilation contribute to about 15% of vesicovaginal fistula in some African countries. Also, we can say occasionally women also develop fistula from cancer, radiation treatment from cancer, injury during gynecologic or obstetric surgery. Those also can contribute. Fistula also can be caused by directly because of the coitus trauma and sexual violence. Maybe if someone raped you when you are still young, it can cause fistula. Infection is also another problem that can bring fistula. And the last one is female genital mutilation that I've already talked about, that it is 15% of 15% cause of people who are suffering from obstetric fistula. We have maternal age and obstetric fistula. In most studies, the average age of women with fistula is 22 to 23. So if you got pregnant when you are below 23 years, you can get fistula. But most of the research has shown that women of below 14 years are more at risk of getting fistula compared to women past 20 years. So yeah, so fistula can also form at around 35 to 40 years of age, because of the birth weight of the infant tend to increase with subsequent pregnancy. So you get that the first pregnancy, maybe the baby was a little bit smaller, but as you continue getting pregnant, you get that your babies tend to get more weight, or you're giving birth to larger babies. So if you are this kind of a woman, you can also develop fistula. Okay, another cause of fistula or underlying societal issue is poverty, literacy, and lack of education about reproductive health, including family planning, nutrition, and safe mother care. You find that in some countries, people are poor, so malnutrition will set in. Malnutrition will set in because they cannot afford a balanced diet, so that when the child is growing up, the child gets to grow well with all the required nutrients. And also you find that in some African community, people are illiterate. They don't know anything about maternal care. They don't know anything about reproductive health. People are just there. They're just living, giving birth without even family planning. They don't know anything about reproductive health, family planning, maternal care. They are just living. So those are the societal issues that can cause fistula. Also, status of a woman and gender discrimination. That one can also cause fistula. Harmful traditional practice, including what I've said, FGM, sexual violence, where you get women get raped, they don't get treatment, children are raped and nothing is done in the society. They cover it. So those things can cause a fistula. So let's talk about complications which may be associated with obstetric fistula. Number one, it is incontinence of urine and stool. Incontinence means that you don't feel when you're going to urinate, or you just feel and you find yourself urinating and passing stool. So number one is incontinence of urine and stool. Number two is chronic bladder stone. Chronic bladder stone. You find yourself you are suffering from pyelonephritis, hydronephritis consistently. So those are some of the complications that might set in. Also, you can suffer from renal failure, because you are damaging. We said it is we have rectovaginal fistula and vesicovaginal fistula. So you can suffer from renal failure because the urine is not passing well the way, or it is not being passed the way it's supposed to be. So also you can get vaginal stenosis. You can also get pain during intercourse. Those are some of the complications. Pelvic inflammatory diseases, amenorrhea, infertility might set in. Also infection in the pelvic bone and pubic symphysis. You can also get those infections. We can also get lumbar plexus and or perineal nerve damage. You can also get a urea, dermatitis. You can also get malnutrition. We also have a psychosocial complication, like you can suffer from depression, anxiety, social isolation. You can suffer from an inability to work, stigma. Those are things that you can also suffer from. And also fistula and childbirth. So fistula do not cause stillbirth, but if a woman has a labor that is difficult and long enough to result in obstetric fistula, it is likely or that the infant may not survive. So that is why prolonged labor, the baby can suffer from lack of oxygen, meconium stain, and those things can cause complication to the baby. So yeah, we all know that prevention is better than cure. Who doesn't know about that? Prevention is better than cure. So in this specific obstetric fistula, we have primary prevention, we have secondary prevention, and also we have tertiary prevention. So primary prevention, we have adolescence and maternal nutrition. So when there is that growth and development taking place during puberty, you have to give your child good nutrition, balanced diet, so that you don't get those bone deformities, maldevelopment, those deformities and maldevelopment. And also under this primary prevention, you have to educate and empower women. You have to teach women in the community about early childbirth, the complication that might set in when a girl give birth or get pregnant when they are still young. Teach them about family planning, teach them about reproductive health, give them all the information that they need to know during maternal care. Give them every information concerning reproductive health. This way we will prevent this obstetric fistula. Also, you can delay marriages and childbearing. You can bring a law that help in delaying marriages and childbearing, so that you prolong growth and development of girls, so that by the time they are getting pregnant or they are getting into marriages, they are totally developed. Under secondary prevention, we have birth preparedness, where when a girl get pregnant, you talk to them about birth preparedness, complication readiness, including transportation and decision making before it is too late, so that even when they go to the hospital, they are told that you have obstetric labor, so you're supposed to go to CS. They don't deny, they don't just refuse. Also, we can talk about under this secondary prevention, you can talk about skilled birth attendants. Tell those women to avoid, those who are pregnant, to avoid giving birth at home, because complications might set in, and those who are helping them to give birth are not knowledgeable enough to identify or to diagnose prolonged labor and obstructed labor. Also, when you are a midwife and you are in labor ward, monitor every labor with a pathograph. They know what a pathograph is. For early recognition of obstructed labor, monitor all labor. Don't assume that woman is making noise, that mother is just making noise, he is not in labor, or that the mother that is not making noise. Monitor all mothers with the pathograph and identify or diagnose obstetric labor and prolonged labor at the right time. So also you can talk about or you can teach them radio to access high quality emergency obstetric care, and also community awareness and raising community awareness, rising and education about prevention and treatment of obstetric fistula. So those who have the condition must be treated so that we prevent complication here. Also, under this tertiary prevention, you can let's talk about early recognition of development, or early recognition of developing or developed fetal fistula in women who have had an obstructed labor or genital trauma, and also standard protocol at health center for management of women who have survived prolonged labor and obstetric labor to prevent further damage. So in case you have a mother who have ever suffered from obstetric fistula, you have to recognize, you have to diagnose this mother at the right time, so that you don't risk the life of this mother from suffering from another fistula. And also you must, or the government has, or the specific hospitals, or those hospitals must have protocols of managing obstetric labor and prolonged labor to prevent further damage of the vagina and the rectum. So I think I've exhausted everything, not everything, but at least I've given you just some of the things that you have to know about this obstetric fistula. Fistula can be in any part of the body organs, but here we were only talking about obstetric fistula. This means that it's related to pregnancy, birth, labor, and childbirth. So I'm going to stop from there. In case you have any question, write it in the comment section. I will explain to you. In case you have any concern, we have our social media on those description. We have all the link. All our social media are on their links are attached to our pages, so you can contact us, or you can contact me in those links. We have go and follow our Facebook account, Nursing Lecture Room. Go and follow our Twitter account. Go and follow our Instagram account. Go and follow our TikTok account. We are only using the same name apart from Facebook, where we are using Nursing Lecture Room, and all the links are attached to this page. So I'm going to stop from there. Make sure you watch this video up to the end, or if you've watched this video up to the end, thank you very much for watching it. Let's meet in the next video. Bye till next time.